This is Barb Hickner with the Family Health Clinic. Today I'm talking to Nurse Practitioner Jean Hurd regarding some of the myths surrounding COVID-19 and the vaccination with COVID. So Jean, welcome to our chat today. And I'm just going to dive right in and ask you a few questions because there are a lot of myths out there about COVID. So the first one is, I already had COVID and have recovered, so I don't need to get a COVID vaccine, do I?
Yes, you do. And I think some of the misconceptions about that were because initially the CDC had said if you had the disease, you couldn't get the vaccine for 90 days. So people thought, okay, I'm fine. And the reason for that wasn't because you couldn't get the vaccine within that 90-day period. We know that everyone that gets COVID has at least 90 days of immunity. Some people may have immunity after having the disease for another 120 total days, but we know everybody does for 90 days, but then that's it. So we have no guarantees after that 90-day period that you are going to have any immunity at all. So the reason the CDC didn't suggest vaccinating within that 90-day period was because initially we had a shortage of vaccine. So we were trying to give people that didn't have any immunity at all the vaccine first, and then vaccinating those that had already had the disease. So you can get the disease more than once. And so it's very important to be vaccinated, whether or not you have had the disease or not. And so anyone that has had it can still be vaccinated and should be, to help to protect them, because we know now, based on that Pfizer vaccine has been out long enough, that we know the immunity from that is at least 6 months. So, you know, we know that that's going to continue to protect you. We don't know that with natural immunity at all. It varies from person to person.
Okay, so after people receive the vaccination, another myth is, I don't need to wear a mask anymore.
That is definitely a myth. And so we still, and especially until you're fully vaccinated, you do not have the immunity yet. That's why you need to allow that booster time. And with Johnson & Johnson, you have to allow the time period after that to develop the immunity. Your body has to produce that. So it's got to recognize, this is what I'm trying to fight against, and build up that immunity. So there again, people are latching on to one little piece of the information, and that is, if you are in a group of people who have all been fully vaccinated, you do not have to wear your masks. That's why when the president is saying, maybe by the 4th of July, if we have enough people vaccinated, they will be able to gather together. And if all of them are fully vaccinated, they won't have to wear a mask. But when you are out in the public, when you are out in the stores, when you are out on the streets, you still need to wear your mask to protect yourself and to protect others. Because with these vaccines, we're not saying that you cannot get COVID. You can get a mild case of COVID. It's like that for a lot of the vaccines that we give. But you're going to get it and recover in a few days, not end up in the hospital and not end up critically ill, maybe not even know that you've gotten it because it's so minor, the illness that you get. But just like we've known with COVID all along, everybody can say, well, I knew somebody that had it and they had nothing. They breezed through it. They thought they had allergies. That's true. But those people that had no symptoms at all could pass it to someone else who dies. So that is the whole, thing with COVID, is that everybody's different in how they respond and how ill they become, but you can potentially spread it to someone else who can become critically ill or even die from COVID. So once everyone has the vaccine, we won't be spreading it. We won't be getting sick. And that's what herd immunity is all about, that then everyone will have natural immunity. And we have a whole generation of people that have never seen outbreaks of polio or even chicken pox. So they don't realize what those vaccines have been doing for the last, 70 years in the case of polio. That's how herd immunity works. And so everyone has to be vaccinated in order for the protection to spread throughout the world.
Okay. So can you touch on a little bit about women of childbearing years? There is a myth that the vaccination is going to cause infertility or miscarriage.
And that absolutely is a myth. The American College of Obstetricians and Gynecology have put out a whole big article and information on that. And they recommend, and that's what these people do for a living. That is their specialty. And they have gathered all of their great minds and said, pregnant women need to be vaccinated. They did animal trials on all of these vaccines and did not have any issues with any kind of fertility or any kind of birth defects. On the flip side of that, pregnant women were some of the highest risk group if they got COVID disease. Everyone saw on TV the pregnant women that were in ICU and on a ventilator, and they were trying to maintain their pregnancy, and then they were delivered, and they might have woken up from their, medically induced coma, and their baby was already a month old. And those were the fortunate ones. So, and it makes sense. This is a respiratory type illness. So if you have all of that mass and weight below your diaphragm, that's why people that are morbidly obese have more issues too. You can't clear your airways. So you are at higher risk by being pregnant. So absolutely, you should get the vaccine. And it's not going to, alter your ability to conceive or have any issues. Whereas actually premature labor was one of the risk factors for sure if you got COVID disease.
Okay, that's good information. I think the myth I would like to touch on today is that I'm going to be tracked, or there's going to be some kind of nano transducer that's going to be in my brain. Can you talk about that a minute?
You betcha. And social media, in this case, we're doing this for social media. We want to put the right information out there. Unfortunately, there is a lot of misinformation on social media. I can tell you that I'm a 5'2" redhead if I want to on social media, because anybody will, you can't verify all of that. So you need to get your information from reliable sources. The CDC, the Indiana State Department of Health, ACOG, which is the group that's, following pregnant women. And in their case, they actually are. You can sign up if you're a pregnant woman who has gotten the vaccine, and they are tracking them months and years out for any potential problems. And we do that with every single vaccine that's out there, with every single medicine that is out there. We are blessed in this country to have the FDA who, that's their job, is to follow all of these things and keep track of it. And with Pfizer vaccine, it's been out long enough that we've been able to do that. But I personally have had the vaccine. Every family member that I have that is of age or is in healthcare too has had the vaccine, and different types, Pfizer and Moderna and Johnson & Johnson. So I trust it for those that are nearest and dearest to me. We are giving those vaccines and drawing them up. I can tell you the process that happens when we get them. That we get our shipment, it goes, the FedEx people are awesome. We sign for everything, we hand it off, and it goes into our freezer or into our refrigerators. And everyone guards this like it's gold, because it truly is, for our country. I wanted to just kind of hold up here this little pamphlet right here that I printed out. This is just the study of, and it's a synopsis of that, a summary for Moderna vaccine. The process that they went through to develop these is so extensive, and we're not reinventing the wheel. That's what people think too. They get scared about how quickly it was developed. Like I said, we've been giving the polio vaccine for 70 years. George Washington figured out that if you nicked into a smallpox on someone and then use that same nick and cut into someone that didn't have smallpox. That's how they inoculated people during the Revolutionary War. So this isn't new. We've known about this for forever, and we're very good at it, you know, and this was a collaboration around the world. Everyone, this is, you know, it's a global pandemic. So everyone is invested in getting us back to normal as soon as we can. So, you know, what I say to people that are worried about being tracked, it's not. And if you're really worried about being tracked, put down your cell phone. Our cell phone knows what time we get up. If it's Wednesday and we normally drive to Walmart on Wednesday, it will tell us how far it is to get to Walmart from our home. So all of us carry around our cell phones and don't think a thing about it. And they really do track our whereabouts. This vaccine is not that at all. It's a liquid. It's not a, you know, Moderna and Pfizer are not a live virus. There's nothing in there that we are going to add into people to track them or cause any kind of problems. And I haven't grown a third eye, neither have any of my family members. You know, it's just, it's bunk. It really is. And I want to reassure people that it is the best way for us as a world to get back to normal.
That is so great. So great. So I heard you say that the virus is not in the vaccination. So
what they do is it's a derivative. So they break it down so that and you know, it's kind of a simplified version, but they give us the RNA so that our bodies recognize, just like George Washington did. They gave them a small part of the smallpox, the liquid from the smallpox. Well, in this case, it's not that live version, so that you do not get COVID from the vaccine. Your body recognizes that and creates its own immunity. And so what you're going to get when you receive the vaccine, as far as symptoms or side effects, normally is a little bit of an achiness in the arm that it was given in. And that's about it. Some people might feel a little bit of fatigue and might have a little bit of stiffness. Some people have a little bit of stomach issues, but it's very, very rare. The case, and in that case, it's still way, way better than having the disease itself as far as the symptoms. You don't have to talk to too many people to find out about those horrific headaches or the high fevers or the lingering cough that occurs when you've had the disease. The biggest risk factor from the vaccine is anaphylaxis. And that is where you have a system-wide reaction that causes you to stop breathing. And so, you know, people were saying, oh, well, someone nearly died. We have given in this country 145 million vaccines for COVID. And your average, the risk factor for having an anaphylactic reaction is 2 people in a million. That's a lower rate than what your chances are of getting struck by lightning. So we don't walk around in fear of getting struck by lightning. Walk around being afraid to have an anaphylactic reaction. And we are prepared for that at our vaccination sites, because if you're going to have that happen, it happens to you within the first 15 to 30 minutes. That's why we make people wait and stay at our location for that 15 minutes. And we do a screening that identifies those that are at highest risk for potentially having an allergic reaction, because they've had allergic reactions to other things. That's kind of their immune system. So we are prepared for that. And we have epinephrine ready to go should that occur. But for most people, the only thing they need is a couple Tylenol to treat the achiness and the little bit of fatigue that they have. And even that, we're on a learning curve. So I don't know if anybody's watched the news, but like South Bend School Corporation, they vaccinated all of their teachers on the same day. Well, then everybody was kind of achy and felt yucky the next day. And they ended up having a shortage of teachers because of that. So, you know, now this time they just did an e-learning day for all of their students, and all of their teachers got their second vaccine. So it is something new, but we're not reinventing the wheel. And so, we have certain things in practice, but I know it's been confusing for people because every day there was something new on the news, even when we first started identifying this. Who would have ever thought that a virus could make you lose your taste and your smell? But it did. And for some people that lasted, a day. And for other people, it's still lingering for months. So we learned these things as we went along. But that's healthcare and medicine. But everybody, all the healthcare providers and scientists around the world are all working and gathering information constantly and tracking, even as far as like people say, well, somebody had the vaccine and they died. Well, with those 145 million people that have been vaccinated so far, there's been 2,509 deaths within the month after getting the vaccine. They have all been researched, and those people did not die from anything related to the vaccines. There have been 0 deaths that are vaccine related. These deaths were because of other things, and it makes sense there again. We vaccinated our most vulnerable population first. So these were people that had a lot of other comorbidities, other illnesses going on. They were quite elderly. So yes, they died, but it wasn't because of the COVID vaccine. And there again with social media, everybody was saying, well, anybody that had COVID, that was what they died from, no matter what they died from. But now that same social media group is trying to make anybody that dies from anything dying from the vaccine. And that's just not the case. And the same way, nobody was labeled dying of COVID if they didn't have COVID. We test for COVID. So they may have had other illnesses, but that COVID disease was what pushed them over the edge normally with if they were labeled as a COVID death.
Okay.
A lot of information.
Really, really good information for us to think about and digest. As we wrap it up, is there any final words of encouragement, words of advice that you have that you want to share?
I just want people to get back to normal as soon as possible. And our way to be able to do that is to be vaccinated, to wash our hands. I find great in the fact that when you can go to a public bathroom and you hear the toilet flush and nobody just walks right out. Everybody's washing their hands. Yay for healthcare. So, some of the positives of COVID, but we all want to be able to hug our family members and see our grandchildren. And that's the way to be able to do that, is to be vaccinated, wear your masks, and we can all hope that by the 4th of July, we can get together with others that have been vaccinated and our country can reach more normalcy.
Okay, thank you so much. And thank you everybody for joining us today. Jean, hopefully we can talk to you again sometime.
And I do encourage people to talk to their providers if they have questions. Your local health departments, the school nurses are all well informed, and your physicians, because there's just so much accurate information out there. So if you have any questions, get them cleared up. Yeah.
By the professionals.
Yes.
Okay. Thank you again. Thank you, everybody. Please tune in and join us next time. Have a great day.